Hi there, Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health and our YouTube channel, Health and Horsepower. This week, I want to talk to you a little bit more about chiropractic and how it can help with shoulder issues. So if you are having shoulder pain or arthritis or rotator cuff issues, chances are you may have some alignment issues going on in your spine, in your joint, as well as some ligament and muscle imbalance issues that could be making your problem a lot worse. In our office, our focus is number one on restoring mobility. So if you're having issues with moving your shoulder fully, we work with you to make sure that we can get the joint moving, release or reduce any scar tissue that's formed around that joint so that you can move the joint how it's designed to. And then we work with you on trying to strengthen and balance the muscles so that that shoulder can not only move through regular range of motion, but it is strong through every piece of that so you can use your joint again. If you've had issues where you've actually had arthritis formed in the top of the shoulder, or you've potentially had a surgery before, or potentially even some tears going on in the shoulder, you have to realize there's 3 different bones that hold your shoulder to your body, and then there's a number of muscles and ligaments that help to balance it. So we actually have our clavicle bone that goes from the center of our sternum area out to our shoulder. We also have our glenohumeral joint, which is where the humeral head of your arm actually sits inside of kind of like a socket, and there's a suction cup or a labrum around that. And then we have on the back side of the shoulder, we have our shoulder blade or scapula that actually attaches and holds all the muscles, how they hold from the back of the shoulder and the back of the back up to the shoulder itself. So all of those muscles from your neck, from your back, attaching to your scapula, attaching to your clavicle, attaching to the actual AC joint where a lot of those bones come together, those muscles and ligaments and bones all work together to allow you to lift your arm and be able to roll that shoulder properly. If we have nerve issues in the neck, we can also get muscle weakness because those nerves in the neck and also the upper back actually go to your shoulder. So a lot of times, if we're having shoulder issues, we may have spine issues going on in addition to bone alignment and muscle and ligament issues. So in our office, like I said, we focus number one on getting mobility back, so making sure that the joint is moving properly. Then we want to rehabilitate the muscles and ligaments so they can do their job and you can get pain-free shoulder motion. And if you've had arthritis, if you've had surgery, we want to potentially be able to reduce that down so that we can get you mobile and stay mobile where you're not going to need another surgery in the future. And if you haven't had a surgery and are trying to avoid it, we may be able to help get pain levels under control to avoid a surgery as well. So if you want more information, feel free to call our office to see if we can help.